Welcome to It's Your Case, presented by VetCT.com. I'm Amy Zalcman, your radiologist on demand for this week. This month's theme is Skulking Around. We will be focused on skull radiographs. A complete series would include a VD or a DV view, a lateral and oblique views. Skyline views of the sinuses can help characterize other aspects of the skull and the contents of the sinuses. Other special views can be used more clearly to define the temporomandibular joints, isolate the nasal cavity, or the mandible. Depending on the goal of the exam, based on your physical exam, a combination of these views may be presented for interpretation. Let's take a journey. Today's example is a 3.5-year-old Russian blue female spade who is pruritic in the left ear. A nasopharyngeal polyp was removed 3 months ago. The left tympanic bulla is increased in wall thickness in comparison to the right being sharply defined and thin. There is also increased opacity overlying this bulla in comparison to the gas-filled right tympanic bulla. There is relative symmetry of the diameter of the external auditory canals without evidence of mineralization that can sometimes indicate chronic infection or inflammation. Our findings for this case include opacification of the left tympanic cavity. Primary consideration would be given to a middle ear effusion, and this can be due to either generalized inflammation or infection, such as otitis media. There is mild thickening of the left tympanic bulla. For this, we would consider mild osteitis that can be secondary to chronic inflammation. And the right tympanic bulla is unremarkable. The radiographic changes of the left tympanic bulla are concerning for otitis media, as we discussed, especially in light of the patient's pruritic ear, which can represent otitis externa. Without chronicity, radiographic symptoms or radiographic signs might not be evident. A recurrent polyp in the relatively abbreviated time frame would be considered less likely, however, cannot be entirely excluded, especially if the stalk was not removed in its entirety, and this can be a challenging part of this procedure. Further evaluation can be made with computed tomography, which would allow for characterization of the material within the bulla. Given the relatively non-aggressive appearance of this, it would be unlikely, as well as the absence of neurologic changes, it would be unlikely to see changes extend into the calvarium. However, this could be observed with computed tomography when using contrast or with magnetic resonance imaging. Be sure to view the full report associated with this case. Thanks for listening, and remember, it's your case, so please post your questions on social media.